Assalamu alaikum badi jibir lalu ngali konton kabale Atlantic TV alla favorite bitilo kachalong men kanal yetene ngotenen kabo talang tannin kilin kata kalan tannin fulakan annal badi malem Fatoumatta Mbye bi fadan nga kachanyo la soto jang bawa manke luntangoti because ni ko luntangot don wala moti me ala malu soto lato, but this is not the first time pour ka soto studio kono jang, of course it's the second time Mr. Sowe. Wolam jumati wolam Muhammad Soti me yalon ko wolam regional HIV and AIDS coordinator ti Western Health Region 2 West Coast region. Woto Hamad jene beduna kacha kono don se bulay ning juber lal se ñu kontong den sedum programme kono.
Comme Madame Mbye ya fo ñame rek ndira to Hamadi Sowe be do ko la bundate coming for National AIDS Secretariat. National AIDS Secretariat nak itel masakunda itel londi pour ka HIV and AIDS ka kele banko kanjang. Officials sort of in all the administrative regions, the 7 administrative regions of the country. So until be sitting Western Health Region to Ndokam. Now official be Office of the Governor, West Coast Region. So comme ay afanya min nata jang kacha jata kenda bunda kachala. So ngalon nembe micro murundila kan pour assez more introduce into the topic, then sina kacha kono nyofano ndi ala baraka bak.
Bawo dunia ko bukatano jata kende akoma miaje ebe wulla everyday be mira la kodole be mira la other activities le jato le be kende yaring bawo ya foko ebe do ko la National AIDS Secretary le, and you are the regional coordinator for West Coast Region 2 dum nin ko National AIDS Secretary man sakunda wulla londi comme ya fo nyamen donc pour ka kele okay HIV and AIDS la banko kan tene bedu na kacha kono folo isa fo mole monem HIV and AIDS te
jata kenda bunda fanotal and sasal siata bakele, especially in the 21st century. Nga sasa kutol leje me yalan ko comme wonema ila non ko wolbe na la dunia kono things like COVID-19, you know, and monkeypox and so on and so forth. But with HIV ate mo sasa merina dinga basa sanji tanani nyong sile kabri ya sute gambe banko kenya. And ni ate jibe akom aboko komi sasa dolbe nyame. But the only difference is ate mang comme jararo soto comme ni ko jararo ni ya soto drum, that means akatere jato kono for the rest of your life. Yeah, you know. So but sign den comme nga jararo soto le borol soto le yalla ko comme ni amin akakuran ke so ni jindele. So atemu kuran ke soto me yalla ko virus solo comme like nga other viruses soto nyame like COVID-19 atafa na mobility virus long me yalla ko comme na bota mo jato akadunno mo jato kono le sila jamalla sila saba mainly maybe nin kacha kono fanu tambo sila saba wal be explain le pour mo ya understand but comme kuran ke solo me alon ka suteta sandi jamalle kisi role comme science lon lu karamo la investigation kono inata realize ko no comme yaje America banko le ka among homosexuals coming kill men ke la istata ka coming kasasa tamasero do le fintindi sense jada kenda coming for PCP, that's pneumocystic carina pneumonia coming watama sifal e ko le fintindi so inata kisiro ke yaje ko coming HIV kuran ke so ni wala ya sabu. So it was in 1984 coming after sanji tanani koma thereabout was when Gambia nataka sute, you know, come HIV phenomena more kono janne. I think that amanta man sere click so come like to say, you know, this is HIV because ate come nin kuran ke so nyundunde jato kuna kay balo soldier la ko le target, you know, like the white blood cells. Sure. For example, come nimo paramata thing as an example. Ibaji la killing telephone and then baramo nyinta ta fala ta kumute ikaje komi e double ko thing ika berol soto de coming for canto berol or something, I don't know. Yeah, but canto berol exactly. So berol ning wala ka signal ko komi ibalo e so jaro soto le mena ko komi aka kuran ke sol kele. So HIV kuran ke sol nak nata dunda jato ko wala la target ina ko le fa ina ko le kele domanding. So this is why near soto sign thing it can take like up to 11 years thereabout. Janika yeah, Janika man science all manifest boloka tandi ya ka itandiko fende be jato kono. Yeah.
A discovered HIV and AIDS kurang discovered America bankoka Isa so HIV ya manage nyat le fa fotata Gambia jam. Fotata no Gambia nyati le.
Health. Ni ajibe comme dunia sota nyo kam bakele.
Sure.
International health regulations wale ya wulu because yaje coming sa se bono Asia for example moy bona Asia because of business or because of family or political or social issues.
Sure.
I traveled into Africa. So in the process, aka sasani natin na nole.
Okay.
So this is why international health WHO, World Health Organization, men ko dunia la jata Kenya bunda inata nying IHR ka dada banko nyanta ka sarto ni sodale. So that ni molbe boka la banko to kana banko to is a kisiro keno. So hani ana traman ke kuran ke hada madungul fangote hani da fengol ka kuran transfer. Let's say you will bondi from US, they are not in the Gambia when actually asasa stole. Well hani na fengol fengol na flower sol thing na yiri ma fengol wadol bi ne sasa soto nole me ano ko comme astarno ida banko nying me ano kaning da fengol yiro ni kana or maybe the plant itself comme yiro ni fengol la leaf sol wala la flowers is a sasa natin nole in the process. So aketo wala nyama and yalo hadama nun ka move back for opportunities. So and the nunto mol fanal ka tama nun back they especially in the East African countries jama bi coming yaje naji be nundo na molu ka tama back East Africa back no places like Congo, Brazzaville, Angola, Nyul Sifal, and some Southern African countries ka tama nun je back kata diamond mining and gold. Mafo coming wala ya natin ang bangko kanja. But wol dulal kaya nun dulal tinmalo ko nga sute nung ko HIV sato nun je bakele. And even up to now, HIV prevalence is very, very high. So because more can move for opportunities for greener pastures. So in that process, ikasasanya natin na wala nyama. So but kabira nata fanang, mansakunda ya sute le ko kami nyumu kulete mialong ko nyanta kan ter sitele.
Sure.
So dunia la jata kenda bunda, that's the WHO. Inata ka Kiliroke Masakundala that every government should make sure that yela health system is strengthened to include HIV service delivery. So this is why ye lopitanol lundi wala ye cement to in terms of personnel, come not so doctoral, laboratory and in drugs. So although niaji come nunto when it started, I'm all tale as a surprise.
Sure.
Because come from Mialonko in the Malong in my yilla, it all of a sudden it appears onto you. So but Masakunda mana ablaje wanyama. Although come near compared to today, be it in moment thing, the number of lobitanol Mialonko coming HIV and AIDS ka wiste ka jara consultation in terms of testing and treatment compared to let's say 15-20 years ago, that's a very remarkable difference. So it's like Masakunda Yakatabakele through the Ministry of Health, National AIDS Secretariat, with support from government and global fund. Yakatabakele come to make sure that bunal ni yele, so that ni botajang ila bungo kono, you don't have to travel for long, to get tested because HIV ala konyin collateral demande.
Sure.
Because kabira findita nan kotake mole to jamal le diala, dol ko feala le tamu, dol ko sata kurang olong, you know what I mean. So because of that, mo bukala fika kata kula. Because ni fango miala ko kami ni ajela molbe chodi lale.
Sure.
So obviously wala molbe toku yala ko imu feala, especially ni fututa. Am kuliti miala ko kami mo bukala fika nakala. So this is wala kunyo kolata no bagele molbe ka findu no ka wisteroke. And because of probably distance and because of stigma and discrimination. Coming kanyo chole and kanyo kajafi, it was difficult for us to get the numbers. So ikaje nundo HIV kamol fanu nyame is different from akamol fanu nyame B. Because like for example in West Coast region Damma, nga Farata Sotole Health Center just here.
Yeah, sure.
Nga Karis Sotole is a private clinic in Busumbala. Nga Tenda ko Sotole. Because we want to also capture the private clinics to ensure that if an say contribute in HIV delivery service delivery, because come moli la kodol sotale, some would probably don't want to go to the public sector. So Melkata the private sector, we don't also want to lose them. So this is why the private clinic will final include
Okay.
yeah, so we have Tendaco and Caris, they are private.
Okay.
Then we have Brikama District Hospital, Nasanyang Sutro in the Combo South, Tujereng, Gunjur, Kafuta in Combo East, and Sibano, Buyam, and Sintit.
Okay.
So Nilopitan will be West Coast Health Region Tule, and they are well equipped in terms of personnel because they are all trained to make sure that ni mo natana lopitano, even if anong kundi mo da male natana. Kana for okay yung kundi mo da male bal, it could be HIV.
Yeah, sure.
You understand? Because come HIV at a fong abuka molfa. Opportunistic infections wala ka molfa. Opportunistic infections ni ojibe mandeka kangoto. Iba fala come like sasal mialanko they come in ning balo nyung victor already. Because come ngala nga fa nyamen diamo kono. HIV ka balo la sojarol lekele. So now sojarol lekele balo la sojarol kele for sang ayo week. Inside your body becomes kind of weakened.
Yeah.
Ela fenti je mialon ka be arela abe protect la. So then ibaje la kono bayol sinanang let's say for 1 month plus you know ibalo infection was sort of like skin infections. Sometimes you can have diarrhea, you know, uncontrollable diarrhea. Nimu modi mel ko balo fana soto you know saje balo ka biko sifal. Sometimes you know you can even develop tuberculosis in the process coming into kurangol. You know because you'll be musa sale de mel ko coming ikanale ning ibalo sojarol invicta. There's another very common infection type of infection kamenje wolong herpes zoster. Herpes zoster jama bi akatara moko koleto ikafa for talinjalo le sumna baloka or something like that. Coming akake like neji kando bon moka akake nyama. So all those are early signs of HIV. Yeah? So but like because ala kuning sign akwaliata bake mulbule, we are not encouraging anybody to look for signs.
Okay.
Because to be fair, near Gambia Banko GB, the population is 2.something million people. As of census na 2023-2024 report. But near GB Banko kan movement test HIV la is less than 80,000 people for last year, 2024. And near 80,000 bondi 2 million kore. Good. So this is why now we are strengthening our counseling services at facility level. Even if you come for mild headache, we make sure that we cancel and test you for HIV. Yeah, because and don't be surprised. There are some people many HIV found we test them and they become positive. Yes, indeed. Because you cannot tell by looking.
Sure.
Someone has HIV. So the best way that you can know if someone has it or doesn't have it is by testing. You understand? So thank you.
Banko kanjang comme yafu nyamen diamo kono HIV nata nyaming and then molka HIV the mentality people have is HIV momundi ya sort of fair ala mudi or sure. So that mentality, that discrimination, that stigma wakati na la molka sila puruka fente kata HIV test nyinge.
That's right.
Mr. So HIV aka transmit nyari la how can one transmit HIV to
in fact wale fon be kacha kan back sign in our advocacy process because yalong come moment fengo melong amari se stereotyping stereotyping in Mandinka probably I would say as a mirror rosoto no mialong ko amanke ate ya mira nyame and nimmo ye siko soto kudo dron as a our own mindset build knowledge about something and in the process as a more from Torah knowledge. So I'm not surprised to hear that still now people have this mentality that mom the HIV sort of fair and that's not the case.
Yeah, and that's the mentality people have.
Of course, in the
more
community.
especially in the communities.
Yes, but that is not actually the case because now HIV can sound in 3 main routes later.
Okay.
We will talk about each of the routes one after the other. The first route is through musoning kewal wala kewoning kewala lanyo ya. Wato ime fongol tanka. When I say ime fongol tanka, wolong wato imang condom use ye lawo nyama. And I will repeat this again. Muso ning keo, maybe keo ya soto muso masoto, and amari mantara jara rola. Wala keo muso ya soto keo masoto, and muso nyime ya soto amari mantara jara rola. Na ning keo kafuta without ka condom ta is muso nying sa keo sawundi nole, or keo nyo fanan sa muso nying fanan sawundi nole. You understand? So natara fana kewo ya soto aning anyon kewo yela because that's a phenomenon nga menje abe caring. You understand? Coming for MSM, men that have sex with men, and HIV siate kono bakel. Kiskisiro level tande ya. So wasilol mo sila latimela kono HIV say sound knowledge from one person to the other. And it's almost about 80 to 85% chances that nimme HIV soto futu wokono isa sound no ada futu monyo lale ne atara alman condoms alman protection ota. But again, there's what we call viral suppression. Ni HIV kurang keso sote balo kono ye test roke juna ye boro nyenta ye boro ta ngol ya fo nyame. And come like it's important to know that nuntun ka borol mendino asiata no bakel that was a pill burden, you know. You come more killing jack about 10-15 tablets at one go, and in that aspect in that regard it makes it very difficult for people to cope, you know, because bore kese killing found the mark coming doctors of about 10-12 medications and at one go. So then saying ye borol nati coming for fixed dose combination. Ye borol tali ye be kafunyama for aketa kese killing the mad. So that's the only thing that you take now. Bore kese killing the whole day, and niata for 6 good months uninterrupted. Come ma sound be yamming or maybe for after 2-3 weeks, 2-3 months you feel that you're okay, you borrow nimbula. More for that. Come yamming continuously for 6 good months. Niela ila yelota, you coming for viral load testing, ninga samba labo ko nga jibe. Iba realize ko ila viral load ning abe jilal to undetectable levels. Ninko undetectable, wala aman ko coming kurang keso ning jaratale. Because HIV aman kurang ala aman jara rosso the follow. We just do treatment ka kurang keso ning jinde. So ni tada lab iba jala ko mila kurang keso ning betalala to an extent that pure mo function abe koleala. So this is why it's very important for people to get to the hospitals early. Ita juna ye fangol biste ye borul ta ya fo ye nyame. So that any futu nyoma priya sound abe koleala. But ni boro nyi ni sa nyi soto imason naka boro nyinta. Some of them model from BJ for nita l'hôpital non to ninga wiste ninko HIV le bele fon se ka kaito ni fon fara de ya fay. You know they don't believe in it because they either they are denied, they're in the denial stage, or maybe because they're afraid maybe nita te suo kono ni afo ke male wala ya la musole wolbe kala futu bangol, and which we see happening. So I mean all those things kakel cool the mala ko coming molka silang wale ka balang ila result sola. So if you continue in that manner, remember ning virus on you membe balokon amantere bottom ka is multiplying on daily basis. So ning ila ikema kafuta wonyama wale la muso kafuta wonyama, you're very likely going to transmit HIV to your partner. That's one bit. The other bit is mother to child transmission, which is another very important program me alonko na bundanyi nga kumaya bale landaka. Because coming out from nyame ning musukono my HIV soto yana dantare da mala. But again no ning muso HIV soto dantare da mala, but na ye kono mata. Then there's another party, which is the child. It's 2 in 1 now. So our focus is puro dindingo nyinge tanka kana HIV soto, because as a sound no dindingo nyinale during pregnancy, during delivery and during breastfeeding. Ning susundiri konoma wato, wulu wato, and ning susundiri wato. These 3 points are very critical. So this is why we said, okay, say nim muso konoma ila first 3 months. You come in for first trimester. You fere ke yena luptano to put ye check. So when you declare a clear call to every woman listening to you or to us here, that if you are pregnant, ya come la kuro niya sawundele karikile karifula before the 3rd month, you make sure yeta luptano to yefongo declare that economatele. Then if you join la nurse, you kaiti nurse kaito dealer. So in that process, when nurse kaiti dindo kono eka kuja male kije eka tetanus pengo dilale eka fancy da dilale eka FIFA dilale borike so wule puri kana yelo kana manke isa sanke for dila no jele. But most importantly eka men for counseling and testing for HIV eko fanankel where no so be kachandila pour ye alon ko akumata bakle pour HIV testing ke so that ni HIV testing ke ni kuran ke so njite la yellow kono then they will start giving you medications on that day so because Gambia ye system wal adopt e coming for test and treat ni HIV soto lung menna wadu na feka jaroro commencer you understand so wo jaroro ning aka menke wolong aka barrier create between demon and batema so that bama ni HIV soto but demon the HIV soto no and you know it's really sad kono ma demental for 9 months yeta ye wulu ye fam wulu mi yalla ko ye denano wulu e ko HIV le bala sasa mi yalla ko his life is painful so this is why we're encouraging every woman out there to ensure that ni kono mata drong ya make sure you futa lopitano to you know you join nurse because for every clinic that is offering antenatal services we ensure that HIV fanake as a package
okay.
And not only HIV we are also testing syphilis and we are also testing hepatitis you'll be most salete me alon coming in the elementary in Seattle you understand so nita da funa fela wulu wato sita you report to the hospital yeta wulu lopitano to at the labor ward so because at the labor ward fana midwife will mel bije mel ko katim mutoke nge karandile comme pour ka dinno nyin tankande because yalno ning wulu be kekan jiol ka fintele yelol ka fintele at that period and HIV nga sutele ko min kewla man yokono anin yellow kono anin some other jiol ko min ka bu muso bala HIV ka sotono wol kono le so during delivery there are tendencies that dingol la yellow anin bama na yellow se mano nyola and you know dingol in batema that's what we call an umbilical cord batakunjulo so that batakunjulo is connected to the placenta so and placenta ning fenka bo bama kono akadunno nanyola ikole nanyo and akatanen through that placenta kata ba dingo nyinka so we make sure that nin dingo nyin wuluta rek janin dingo nyin ka wulo midwife o yalo ne coming anyanta munekela pour ka dingo nyin tankande at the time of delivery so nata da fa wuluta fana nga siropol sotole me yalo kon ka di la pour ya di dingo la so siropo nying yalo komi bama la sunyu no nya ala force sunyu no nya is very important it coming for cholesterol so that cholesterol ning wala ka dinno la force immunization of diala wala ka dinno la komi ala sunyu protection on nying dal for the early days of his life or her life so but sunyu no also contains HIV be sunyu no kono natara moya soto ala sunju no kono HIV fana sitarano jele so this is why ko boro nyin diala pour dinno nyin kana HIV soto during breastfeeding and yalla there's this government policy through the National Nutrition Agency and other advocates that is very important pour dinno is for 6 good months it coming for exclusive breastfeeding so but exclusive breastfeeding in the face of HIV ala impact sodale so this is why suropol di dinno wala pour que protect from contracting HIV so we talked about two things follow wala kewni musola kafo wala kewni kewla kafo the second thing we talked about is mother to child the last one is blood and blood products la transmission on so coming nkamol jeremial ko coming they are drug addicts we call them people who inject drugs. Ika bendangol ta nidulol ta bendangol ike balon so ika bengol drokol tunije. And we also see that they have the tendency come puka bendangol share. Ite ifang so ye droko dundi balokon fe pareta. Ina the same nidul ta yadi modo fana no fana ya use. So nite HIV soto ofana sa sound nole. Na nyaka to tal fana is another avenue.
Factor.
Yeah, come like dinding tang, dinding muang, dinding keme, lancet killing, wala muru killing. So in dinding killing sa soto automatically you transmit it to the other people. So these are some of the things. And in organ donation, though among Gambia like kidney transplant as an example. But the budget will be their tendencies, but a rigorous investigations like Janeka organ transplant. You understand what I mean? And blood donation is another avenue where HIV can be transmitted. So, for example, ni ilamuso wale kema wale do my body wa sulata yelola. Ibita ekomi yale ko komandiro kala purum wale donation okay. So, in that process of donating blood, there is a high recommendation pour ka yellow nyita ka kisi because nima yellow nyi kisi ni atara komi moy sa sound. So these are the three fundamental ways that HIV can transmit no nyame. But ika kuma jamal le moy satel kono dol ba fule ko komi ni moy HIV soto na excuse me naka wafiro ke ni ala fengol sang ifana be HIV soto ay soto dol ba fule komi ni moy HIV soto na atarata na ala deni ko wurang ni defana yo dungo HIV soto hani mositala. All those things are misconceptions. And dol fana I used to hear ka fu ko ha coming ni susula ye king ning modo fana ya another person king of fana is HIV soto no they are all misconceptions. Toothbrush all call be mwele but they are all misconceptions. Wala ndanga domuro domo tanga mburo domo ngadi telefona ya domo does not give you HIV. These are the only three fundamental ways that HIV can transmit no nyame.
Kuna yafo come more HIV and AIDS soto I borota constantly for 6 months ala fonko ni kuranke so ni aka jibakele sometimes on yellow ni samba lab acetano undetectable but it doesn't mean ko amantara yellow kon.
Exactly.
For instance let's say muso HIV and AIDS soto and then the person amari bet treatment takane constantly fala state of nyintata undetectable but anin kew nyimbe fu anin kew be futu kana kew ma soto for is a futu continent no water without using protection, let's say condom or another part.
And in fact the clarion call is that people should do what we call premarital counseling because science sasal siata hata munke HIV.
Sure.
So ning mol bitaka be futu kan inyantale comme pour yin kis receive ke. And I remember somebody told me ni atara coming lafta moment futu la mari test positive fe o futu woni o manya nakata fo futu woni da bayla lema. So it's not in my capacity to say futu woni bang. Very Kano does not look at outlooks. Of course we know HIV is incurable for now among jara rosot men kaka kuren kisol nim fa balo kono but there is treatment. So but like undetectability comme pour la virus on yingi tatu and level that hani la yelo kono wiste ikaje comme adoata bakele wo fo damma is equal to untransmissibility niko untransmissibility walang pour mo sound courant la kolata bakele but there is one very key thing which is disclosure won issue bality in HIV that is kewe HIV soto ayatala muso ya kari wonam antara lobitano to le wiste le bare ko HIV it's a very big problem in among people. Simply because nakacha ko nga start nyame we said because okay ni asoto mu fe ala leti you understand or ni asoto sata kurang all those kind of things. So because of those kind of feelings akakola bakal pour mo le disclose but it's very important that moment the HIV soto imanyane mabele partner because your partner also needs to know his or her status. Exactly. This is why saying we brought in what we call index testing. Ning muso ya soto ala immediate contacts will be invited to test them. Ning kyo ya soto the same thing. So that so HIV through fano because ning ete jara ite the most savanani connector. It don't always work on. You understand? At the end of the day, I'm saying my problem is solved because we don't better la jele mian ke better HIV soundika and positive living mo kulate mian ko coming ni mo HIV soton ke kachanda ala that is ibela life samalu no nyadile wato you are physically okay you are psychologically strong you are socially how do you go interact socially. You are able to practice your religion, okay? Your physical status is fine. And your physiological status is also fine. Physiological, ibalo kana kurang soto. So, but either matter can wala fonse ila partner involved. But there is also what we call PrEP. That is pre-exposure prophylaxis. Bono le meal ko coming ni muso ya soto keo ma soto. Inka adi keo nyina la pura kana sasanya soto. Nin keo nyi ya soto muso nyi ma soto. Inka boro di ke muso nyi fana nale pura kana soto. Wol bebe kerenne. So my advice is ni moment the HIV soto kana imabo because that's where the problem is.
Sure.
Ni kewa wisiri nyoka ikewa malanko HIV le bela and probably he needs to protect himself with condoms janning ake ila virus ka suppress wala anyanda ka borul tar nganyim PrEP men fata anyanda ka tanole janning ila virus ni ka suppress then atatalo na wanyama wetara blind le and dindongol fon le so fon ko me ko coming inyanta ka maybe expose ni gol malenu automatically what final be sasa you so in the process so maboro ni is not the solution and kabo from one place to the other, from one clinic to the other, in the name of Malafi Kari Enje, Malafi Fatoumatta Enje, Malafi Mr. Sowe Enje, does not solve the solution.
Sure.
That does not solve the problem. So the most important thing is that you accept your status. Mo bukata marse to kafe ala wala nada sasa lesan. Or you go and pray and like okay ala ma sasa dinna. You know? No. But anything that is destined to happen really happens. So mo man yana self stigmatization of come from stigmatized. To an extent that you will not be able to do what is expected of you medically. Yeah.
We cannot talk about HIV without involving the youth in it. Because Bankobe funding level.
Big time.
So how can youth contribute in fighting of this HIV and AIDS in the country?
Funding contribution in HIV is very, very, very important. HIV la sound in 3 different ways. Nga futu wala karo fojele. And yalla funding ko la mamol siata bakele they are the ones me yalla ko itelle ka futu wala ko ke bake they to ba coming for reproductive age and they are also the sexually active group so ni HIV jibe futu wala karola ni ajibe bama ni dingola karola soundro ni ni ajibe comme yellow la karola futu wala karo ni siata
sure
but again ning funding ko me yalla ko wala nyanda kala the champions if is it a coma, then there's what we call a silent epidemic. Wala bekela. Ibajela sasa ni la wela dumale without knowing it. Although nka data will suggest that you come also, for example, like last year annual math from 2024, we had about close to 3,000 youths Milan coming here testing for HIV.
And they were positive?
No, we already tested them.
Oh, okay.
About over 3,000. But near West Coast region, GB as an example, census la 2024, 2023, 2024 census attended about 1.9 million people, thereabout, the West Coast region of Tundo Kona. But testing 3,000 youths. That's not enough. So this is why we are really so very concerned. So ankate tari la school to la sign to raise awareness. But that's not enough. Because near GB near Sate Kono GB, out of 10,000 youths, modular school Karamodo, Amansia. And on the school of the fana, it's like you are missing those on the streets. You understand? And the design is that Nintara school older, those in the schools will now transmit information to those on the streets. But Obuka Keno. And they found sometimes when you get our community for sensitization, it's very interesting that Paring the mirror, we call the those that are 60 above. Who has now done their life parental,
sure.
And they are not the population of interest for us. So this is why we are appealing to every youth to ensure that at least Lumbon will be a champion for HIV sensitization. HIV Abidjan,
sure.
It's in this country. It's in West Coast region. It's in Farato. It's in Brikama.
And it's good to remind people of that.
Of
HIV
course,
still exists.
It is.
People tend to forget about HIV.
No, it is.
Yeah,
come at some point. There was some silence about HIV, but for us who are given the mandate, like us who have the information, data sort of we go monthly to all the facilities to collect data.
Okay.
We can tell you for sure and for free that every day, at least 1 or 2 people can test positive for HIV in West Coast too.
Okay.
That is from Sintate to Farato.
Okay.
So nilong facility to me HIV visitor jang. And funding they are the cream of society.
Sure.
Some telebekala na minister na president na safe holding alcohol. But if they get sick now, automatically we will not have a guaranteed future.
It's going to be horrible.
So it's important that you don't wait until when you get sick in order to get tested. And that's what the problem is in the country. Now the funding call, I could remember covering Mansakunda or that trip to, is it Saudi Arabia? Or Spain, something like that. That job opportunity.
Yeah.
Some months ago, to go to Saudi Arabia or to Libya, I don't know where, for farming or whatever, for employment opportunities. A lot of youths in thousands, it had a little bit of like a medical certificate. So okay, you only wait until when those kind of opportunities comes. That is when you want to take your health seriously. And then you jive come is HIV soto nole. I started bolo kono. Abe bolo sojorol wigla. Even more sound na what it for malo. And then me for kafu. O fon boka lo fon sanko HIV lebe because it's not written on your face.
Yeah.
Yalla ni malaria bela rek ni moye jela safa nyende ngamra malaria la bala. Because it's easy to know. But with HIV it's a taranole. There's no clear cut sign to show that HIV lo nyende. So akakole abake. So and we are appealing to the youths to take this message seriously. HIV akatankandi nole. When we go to schools, all that we tell the students is to delay their first sexual contact. Nibe karambungoto, make sure that your books are your friends.
Sure.
Make sure that your education becomes your priority. So that niji da sama sining, isela wululal nafano. No, in fact, if follow nafa.
Sure.
Because ni tara kira president wote jani bama ni fama bakala butala. You see what I'm saying?
Yeah.
So then the next thing is ira wululal nafa ye jamano nafa, you become an asset to society.
Sure.
But say ni tara coming either grade 8 or grade 9 or grade 10 inin kewol kakafunyola, you know, at the end of the day you start developing STIs, not only HIV, there are other STIs that will develop no. It's a konoma in the process, ila karangwe natinya. You understand? You become a liability. Ila dengonye mfong membi bemo wulu la fong na criminal bad society.
Yeah, sure.
You know, we see all that happening. So students who are going to school and those not married should stay away from any sexual contact. Because ni ya kumase, you don't know where it ends. And you know, madam, let me tell you something. You know, there's a lot of distraction in this country among the youths. Saying more laughter film bakele. It's like vanity, you know, it's causing a lot of distraction. People want to get rich overnight. People want to be celebrated overnight. People want to become celebrities overnight. People copy a lot of foreign ideologies overnight. So, ning ita laughter film bake. Remember, there is someone who has something out there that you want.
Yeah.
Amari lafta femvendene bulokona. That's what the person is gonna get from you.
From you, absolute right.
You understand? So, and this is one thing me alonka kan kijo farande back funding la the desire for wealth, the desire to get rich overnight. Niajibe coming even this backway journey is something me alonko it is more rampant now than it is before. If you look at the data, ning IOME la data share of 2018, and they tell you the number of youngsters me and Botanang, or let's say 2017, you mail Botanang Bangkok and travel through the back way. Compared to 10-15 years ago, it's way, way different. So funding could be ilafta ka kusoto fast way.
Yeah.
So in the process,
money.
We have places in this country, or we have some set of people, we call them the vulnerable groups, and the youths are one of them. Nitara in the tourist development area. I mean, I respect the tourism sector because economy is pushed back. And I'm not saying that every tourist that is coming here is a sex tourist. I'm not saying that. In fact, there are even our Gambian brothers and sisters, you know, they are in the industry. Because Yalone is a place where there's a lot of distractions. There's a lot of attraction and distraction. So wakonola, you know, mose genole, I leo into getting something. Maybe as an iPhone 16 dealer nole, or as a fen dealer no miya, well, as a promise no that he was going to take you to Europe or something in exchange for sex. And you know, we've done some investigations, and I realized if you go to brothels, we used to work with female sex workers and other people. Some would even prefer to pay more money for unprotected sexual intercourse than protected sexual intercourse. That is with condom and without condoms. So near the more offer, let's say $10,000 or $5,000 for unprotected sexual intercourse. Ina kafunyo madrong. Aina sasa dile mel ko is lifelong. If motora, you know, society tora. At the end of the day, you know, you become a liability in society. So this is something it's worth discussing. You guys work with time, but I hope we have another opportunity again to discuss this.
Have that.
We will talk more about youth involvement in HIV because they are the drivers of the epidemic. Of course, the messages are there. You know, it's one thing coming in cafe, but it's another for you to know and realize that Mr. Soka nyimem fonyede na sama na fale bije.
Sure.
We are spreading the messages. We go to schools, we go to the radio, and I thank you so much for inviting me over to your TV station.
Sure.
Not the first time. To for us to be able to discuss openly about things that really matters when it comes to fighting HIV in the country. Thank you so much.
We have so many important things to discuss, but then, like you said, we work with time. So, lefela yela final advice to the general public, and then we call it a day.
Ndebe mol men yamarla, be mol me fon yamarla menna, ani be mol yamarla menna. Wolonko HIV manke satokura mate. When you say that maybe 10, 15, 20, 30 years ago, I may believe in it because come nonto coming jata kende among sembosto nyama. But science is so advanced. So ngafu no nyama coming borol from kamenta is just one tablet. So mo kana siswo kono yesila wala mo kana nyochode. Kafu e karinaji nunta bolobe warate ne science afila be jika 8 lebala. You know, you start running away from the individual. Yeah, mari discouraging the. Yeah, far what performance. So it's good that we give each other, you know, the hope. Ko mobu kata dua kami kasasa. And just because somebody is HIV positive does not mean that amare mu fair lalit. We see people contracting HIV from all the methods. Me alam ka ning fair man ke kilindi. You understand? So be mo yamar la kami ka finti ñu loptanol nga mel for all these 10 places. Let them go there with their families. Okay, formal test. If they found positive, amanja de panic la, they can take drugs just like diabetes. People are diabetic here, people are hypertensive here, so HIV is also one disease that is as lifelong as diabetes. It's as lifelong as hypertension. So but ni boro ni sasanya soto imanson kaboro nyinta awela baro la sojorol ni bikla every day, and it's not just going to stop at you. Because come nothing the malo, you're just going to die. But you will also infect other people. And that's unfortunate.
Yeah, it's indeed a great pleasure to talk about our health. So for sure, to discuss more and probably give us the data on HIV and AIDS in West Coast Region 2. Just like Mr. Sowe Yila HIV status test to know your status on HIV and AIDS. HIV and AIDS is as normal as other diseases. So akumata bake prumo ifentieta yela status ni check. Kadum fanang akumata bake prumbenga join hands to fight against AIDS because it's not an individual thing, it's the whole world's problem. Likewise our Gambia. So alinga fentim benga denga HIV and AIDS nga kele pruka turufa Gambia banko kanjam. Bedanale jane futene nala inshallah. Allah baraka bake Allah jiber kunyi mala futene nala.